Okay, I'm going to just start with, because we had a question for you, Datis, on your information there. Zach Lyon Nutrition, active on Twitter. Thanks, Zach. He says, is neuroplasticity powerful enough to combat MS and other neurodegeneration? Can it mitigate decline, mitigate cognitive processes?
So the fact is my mic on?
Yeah, we're good.
Okay. The fact is that whatever neurons you lose, you lose. Dead neurons don't come back. Okay? There's no Frankenstein event that makes dead neurons come back. Neurons that are dead are forever dead. All you can do is make existing neurons reconnect. So when you're looking at any neurodegenerative disease, whether it's MS as an autoimmune, or Parkinsonism, or Lewy body disease, or alpha-synucleinopathies, whatever the protein disease is, there's this balance of how quickly do you make them connect, develop plasticity, versus how quickly you have loss, right? So what we do in a functional medicine model is we try to reduce loss by looking at methylation and inflammation, all these things, but I don't think we do enough to cause connectivity, right? We don't look at, hey, this person has MS and they have symptoms of a left parietal lesion. Let's do some left parietal types of activities to make those neurons connect. So the big answer is you can only develop more connectivity than you're losing to develop function back.
And some of the ways to do that, it seems like that's not supplements, but lifestyle, some of the things that you mentioned there. What would you say are the sort of the key things? We talked a lot about in the forum how sort of community is a big part of health, and it seems like interaction with other people. Is that a part of it?
Sure, so lifestyle is a really critical part of it, but at the end of the day, you sometimes need to do specific activity for areas of the brain, right?
Okay.
So if you have memory problems, you may want to play the memory matching game, right? Or you want to start to memorize your phone book, right? And try to really actually activate your brain to those areas. So it is region specific, it's not disease specific. It's just a matter of looking at the overall function. So obviously community and lifestyle, all those things make an impact. But when we talk about brain, the brain needs specific stimulation, activation to recover in areas where there's loss.
Awesome. Well, we'll come back to that because we have had a few specific questions on that. I want to introduce Pedram. Pedram, thanks so much for the space. This is your set. You have this book coming out in a month's time about the urban monk. If you were listening to the Evolution of Medicine Summit, you would have heard a little bit about it. But you know, one thing, when we sent out a survey to practitioners, we asked them, and the biggest thing that came back of what practitioners were looking for was more time. They don't have enough time. Now, have you heard that before from anyone else? And I know that there's some juice in the urban monk about that, and I'd love for you to share that with our community about some of the strategies, because this is for practitioners helping their patients who can't get their act together, and also, you know, for us helping these practitioners to get that time back.
Yeah, absolutely. I would start by saying stop sitting, period. Right? You want to capacitate and use your day to stay active, and in doing so, you feel less guilty about not making the gym after you had all the charts stack up. Right? And so one of the major pieces in getting time optimized is chunk time. And so staying active throughout the day keeps your blood flowing, but chunk time gets you to do specific chunks of work and then move on, and not check email in between, not do all the million things that we think we can do by the presumption that multitasking even works, right? And so I've been through that. I've been in hospital-based systems, clinics and all that, and look, if you don't stay efficient and chart as you go, by the end of the day, you are hating your job, you're hating your life, because you're never going to get home in time, and it causes family trouble. So, I guess the long answer to that short question is get really efficient throughout your day. What helped me the best was getting off grains, period.
Yeah.
Right? It's just wind drag. You don't want to slow yourself down throughout your day, and then when you do that, you can be clear when you need to be clear in that chunk time, and just leave when it's time to leave instead of stay there. And I know a lot of us, it affects our family lives. It really impacts our personal lives because the work is so enveloping.
Absolutely. No, absolutely critical. I know you have this book coming out called The Urban Monk, available February 2nd. Make sure to check it out. But I just wanted to ask you, what would a monk say, and you are a monk, so I'll ask you this, what would you say, or you were a monk, what would a monk say about everything that you've heard tonight, the degenerative disease, the lifestyle-induced, neurodegenerative disease, and the state of medicine? What were your thoughts on all of that?
A lot of this ancient wisdom has really come back full circle and hit us in the face, right? It's not about interventions. It's not about expensive solutions once you've broken it. It's not about the body shop. It's about the driving school, right? And so all of these practices that we're talking about on the front end are trying to get us from getting derailed. And yes, there's expensive procedures and interventional stuff, which is where the healthcare system is focused right now. But it is a profoundly different universe when we start looking at our food and we start looking at our air and our activity and all the things that can keep us out of that body shop.
Yeah, that's it. I love that quote. Okay, well, let's go to Twitter. We've had a few questions coming in here. Dr. K, this is from Vikram Khanna. Dr. K, any thoughts on the acupuncture cluster of points they call windows to the sky? They are used widely post-CVS. Have you heard of it?
Well, there's lots of research that shows that acupuncture activates the insular cortex, the parietal cortex, and dampens pain by activating an area called the periaqueductal gray. But as far as the specific points, Pedram, you would know more than I would.
Yeah, I've never seen any studies on the windows of the sky. A lot of them are off the head. They're kind of like more in the thoracic outlet, but I don't know of any specific studies on that. Yeah.
Doc, we've had a few questions about that case study that you shared. What exactly was the 2-minute treatment for the lady with ataxia from cerebellar degeneration?
So one of the things that we found with her is that when we did something called a head shaking test, we had to put on some goggles and shake her head, that she developed something called downbeat nystagmus. And I didn't show the video because it's really hard to pick up a nystagmus unless you're looking at it all the time. But she has downbeat nystagmus. So one of the things we do is her brain thinks that she's falling backwards, that her vestibular system has a sway backwards. And when you put her on a posturography, she has a sway that you can measure that she's falling back. So when we had the red and white strips, it's kind of like looking out of a window of a train. You see things moving. So we've had it go in such a way where her eyes would fly upward, so her brain thinks she's falling forward. So we're trying to rehab the areas of her brain. So the areas of her brain that are falling back or weak, and we have to activate the areas of the brain that pull her forward in order to activate her cerebellum. So optokinetic activation is that red and white strip. Those are very specific cerebellar type therapies. And that's all found in Lee and Z's textbook of neurology of eye movements. It's just basic neurology.
That's awesome. Yeah, it's super interesting. You know, this is maybe contrary to what you were saying earlier, but and maybe Hyla, you can chime in on this too. What is some of your favorite nutrients to stave off Alzheimer's and other brain dysfunction? Hyla, you want to start?
I can address that, sure. Yeah. Phosphatidylcholine, phosphatidylserine, ginkgo, acetyl-L-carnitine, vinpocetine, huperzine.
All the zines, basically.
Right. And they really make a difference. I mean, I've had patients who were having incipient Alzheimer's, and putting them on combination products like this have made an enormous difference. And very good for prevention and actually for some rehabilitation too. You're not going to cure Alzheimer's with nutritional supplements, but they're very, very useful. And I've actually put together combinations like that because people are not going to open, especially if somebody's a caregiver for someone who's losing it. And I'm saying they may not have frank Alzheimer's, but it's a lot of work to open a lot of bottles. So better to have combination products.
Absolutely.
But with the right amounts, but very important. You don't want fairy dust. You want the right amounts, the research amounts in the formulas.
Good stuff. Datis, you want to add to that?
Nutrients for dementia and Alzheimer's?
Yeah.
Well, I agree with Hyla. Those are all the key nutrients for the punch. My favorite one is huperzine. There's a lot of good research on huperzine actually changing beta amyloid plaques, which is unbelievable, right? And galantamine is also a phenomenal supplement that's been shown to be very helpful for beta amyloid plaques. And they also both help memory. And both huperzine and galantamine are acetylcholine receptor agonists, so they can mimic the receptor site and bind to it. So even unrelated to dementia, if you just want to improve your memory, your long-term memory, okay, you can take those compounds, huperzine, galactamine. Those are phenomenal support for memory.
Oh, awesome. Curcumin.
Curcumin.
Sure.
Because it's anti-inflammatory.
Let me just ask you this question, because I wanted to ask, we've got a functional neurologist, holistic psychiatrist, someone with a range of skills here. Should psychiatry and neurology be taught separately? Should these be different specialties, or is it time to sort of treat brain-based doctors as one tool? I mean, the future of psychiatry.
Love that question. I love that question, because I was thinking when I was thinking about what I wanted to say today. One of the things was I'm very grateful that I went to medical school. My early psychiatry training was really more like a psychotherapist. You know, I learned how to do psychotherapy, but more and more I'm actually going back to my medical school roots, to my medicine roots, to physiology, biochemistry, anatomy, and I do think they should be closer. It's a common board. It's the board of psychiatry and neurology, but they're kept separate. I do think there should be more combination. There could be more emphasis on psychiatry, more emphasis on neurology, but seeing psychiatrists simply be prescribers of medication does not make sense, or neurologists simply watching deterioration and measuring it as you continue to go down the path of MS or ALS or whatever, doesn't make sense anymore with what we know.
Absolutely. Datis?
Well, I think we need skilled neurologists and skilled psychiatrists for proper diagnosis and workup. Those are critical. But the application is not to improve brain function. That's where I think we're missing it. So at the end of the day, you have to improve brain function. So yes, I think they should be, they should have cross-trained with each other. But at the end of the day, if someone has unhealthy brain, you should use nutrients, you should use activation, you should use exercise, you should do things to actually improve brain function. For me, I was at a shock once. I was teaching a seminar and I had lunch with a person who became a friend of mine who was a psychiatrist. And he was saying, I want to ask you a question, but you don't have to answer if you don't want to. And immediately I'm thinking, what is he going to ask, right? Mm-hmm. He goes, I'm listening to your talk, and I'm thinking that maybe some of my psychiatric patients may have like blood sugar issues, and maybe some of them may have like actual thyroid conditions.
What a concept.
And I go, what? And his name is Bill. I go, Bill, you don't check that? He's like, no, that's for the family physician. I go, why don't you check that? Because I don't want to offend them. I remember thinking, going, wow.
Yeah.
So it was this whole disconnect of different systems, right? So psychiatry just being mine and neurology just being neurodegenerative diseases is really it's not an efficient model.
No, it's not. Well, let's talk a little bit more about efficient models, because Pedram, I know you've run interdisciplinary clinics with lots of different practitioners working in them. If you were starting those clinics from scratch today and had to think about how best to provide care for these kind of things, what do you see as the sort of the best structuring of clinicians in a team to be able to deal with these kind of things?
Great question. First, just solid EMR platform where we don't have these types of problems and the practitioners can cross and look at the data and look at the diagnostics. I agree with Datis. That look, the diagnostics are solid. We can really figure out what's going on with the person very well. From there, the quarterbacking of that case has been atrocious in most settings, right? So I would say a functionally trained doctor being in the quarterback position and having an arsenal of the different practitioners around, be it naturopathy and acupuncture and chiropractic and whatever else is needed for the patient population, but having someone who understands their team and how to triage that care based on the diagnoses, and then just doing good old-fashioned rounds and treating each patient with the team. That has, in kind of the early inception of these models that I've worked, been really effective, and we're still pushing around paper. Now with EMR, with some of the innovations, and take-home kits, like you could create a video kit for pretty much anything and have your patients basically have a subscription to a lifestyle and wellness channel that you as a physician produce, so that you can follow them home with one time of work in front of cameras and lights and all that, but then you have that kind of follow through and that education that has been lacking in the hand-holding. And again, that's where nutritionists can come in, a lot of different practitioners to be there to deploy and then report back if something's flagged and we need to track them better.
Absolutely, yeah, that's a key point that you're making. If you've been watching our stuff for a while, the time that you saw Pedram before was we were talking about corporate wellness, and it just seems to me that on this edge of neurology and autoimmunity, there's a massive payer issue here, right? Because these are obviously the most expensive things, and autoimmunity, if you think that autoimmunity is playing a role in, the genesis of all of these, what about, how can we how can businesses run a more efficient ship? Because I'm sure that these patients are costing the majority of the money, no matter who's paying.
Yeah, it's a challenge. It's a challenge with privacy. I know a lot of CEOs that have come to me saying, I want to do genetic testing, and then they get pushback. On the flip side, I've had companies bring us in and say, we really need to figure out how to help our population. 2 weeks into surveying them, the obvious answer is you're stressing them out. So how do we rectify this? You got to throttle back on how you're driving this workforce, and so it becomes a political issue and a privacy issue mostly. If the C-level is into it, I've had lots of C-level executives come in, get a full battery of tests. You know where the icebergs are. You know how to navigate. And you do the things that Datis and Hyla have been talking about, is really figure out how to not get the neurodegenerative disease, not fall into these problems, right? But I got to say, in corporate, it's politics, and so each individual case is different.
Yeah, to come to your point there, Datis, you had that graph of sort of the sloping curve. What are some of the things that primary care, nutritionists, everyone who's listening, every provider can look at as those early signs so they can catch it before they get too late?
Well, let's say start with yourself. Has your handwriting changed? Has your handwriting gotten worse? How's your memory? How's your recall? How's your endurance for cognitive activities like reading and driving? If those are going downhill, you're neurodegenerating. It's just that simple. So all the things we talk about in functional medicine, whether it's leaky gut or dysglycemia or prostaglandin imbalances or hormone deficiencies, whatever they all have an effect on a tissue that has no more cell division, the brain. So the brain has no more mitogenic cell division anymore. So whatever neurons you get are the ones you're born with. Now over time they connect to each other to allow you to have function. But if you're noticing those things come down, it's not aging, it's loss of brain activity, right? So we have this tendency to think, oh, we're just getting older, but it's not getting older, it's actually neurodegeneration. Now, in your patient population, if they can't find your office in time, because they get lost, right?
Yeah.
Someone has to drive them to the office, they forget their office forms. It takes them forever to do your office forms because they're neurodegenerated, right? You look at their forms, their handwriting is off. You see them walk and they're not walking with proper gait. Right? You do a history, they can't remember, they fatigue in your history. Those are all signs of neurodegeneration, and the patient is never going to come in and tell you they have early signs of neurodegeneration. So you as the clinician have to pick those up.
Absolutely. So it sounds like there's some great questions there that any practitioner could ask, like, how things have changed over time. Hyla, do you do things like that with patients? How do you, people are coming to you mainly with already, far down the line for kind of issues. How do you sort of, how do you set up hope in that sort of situation where typically hope has come from a pill?
I do a full workup. I mean, I do what the family doctor should be doing. I do basic lab tests. I look at thyroid, adrenals. I look for anemia, vitamin deficiency, some really basic things, and start from there. It's not just throwing vitamins at them.
Dr. K, we had one more question here. Lots of great questions on Twitter tonight. Thank you for everyone who's participating on Twitter. If you determine someone has gluten sensitivity, how long before noticing a positive change in brain function?
It all depends on the extent of the injury. Okay. So gluten sensitivity is one thing, but gluten sensitivity that turns into neuroautoimmunity is something else. Gluten antibodies are different than if it's transglutaminase 6 versus actual gliadin. Where now they have gliadin with cross-reactive cerebellar issue or gliadin sensitivity with myelin basic protein. Not to complicating it, but it is not that simple, right? So we published a paper 2 years ago where we looked at 400 healthy blood donors, and we looked at antibodies to wheat and gluten, and we looked to see how many of them had neurological antibodies. So we found was approximately 15% of the healthy population have antibodies to milk or wheat. Wow. Of those, half of them have antibodies to myelin or cerebellum. And the ones that had antibodies to casein, alpha-beta casein, and milk butyrophilin had very high myelin antibodies, and the ones that had gluten antibodies, many of them had cerebellar antibodies. So if you have gluten sensitivity and you have cerebellar autoimmunity developed from it or myelin autoimmunity developed for it, you may not even have MS, noticeable symptoms yet, but your recovery rate is going to be totally different than someone just has gluten sensitivity and they have a little bit of brain inflammation, right? So it depends on the extent of the reaction.
And Pedram, last question here because we're going to wrap up. From the Urban Monk book, what is the tip for doctors who are listening and also for patients who they're going to work with on simple things that they can bring into their life to aid with the kind of things that Datis was talking about here?
I would have to say one of the most important pieces in our understanding of how to take care of ourselves is that a lot of the mind-body practices that have come over from Asia have really been ascetic practices. And here as householders, busy people, we're trying to practice things that we don't have time for. So I'm so guilty I didn't make it to yoga. I don't ever get time to meditate. I don't have time to meditate an hour a day. I'm sure neither of you do, right? But I can take 5 minutes in between calls. I could stop when I'm in an elevator and not check my phone and just check in and stop. And I think that there's, it's almost like flossing your teeth. There's a mental hygiene that needs to be built back in culturally, because we've accepted these excessive amounts of stress as normal, and we just keep taking it on. So learning to layer that on and teach our patients how to do just some basic mental hygiene and de-stress wherever they can in the little minutes that they have here and there has proven to be very effective for our patient populations. And it's just common sense. We're heading in the wrong direction with stress.
I mean, I'm just thinking out loud, but you said you need to curate an education program for patients, and that education program probably should be something repeatable, like an online. We've talked about that, and we will have some resources coming later in the year, sooner rather than later, actually, of people who have created those sort of assets to make it easy for you. But it seems like, recommending or prescribing the Urban Monk book might be a good step.
Yeah, please do. I'd love it. It's one of those things where if you can't prescribe, like I can't follow someone to teach them meditation, right?
Yeah.
But I can hand them meditations when they come in and say, here's your welcome kit to our practice. And it has some recipes, it has some stretching, some basic functional movement, here's some meditations, and here's all the things that I would teach my son so that he can stay well in this world, right? And so what kind of care kit can we create for our patients so that we can take these lifestyle practices home? That's how I'd like doctors to start thinking, because we can't follow them around. But what's happening is the lifestyle that they're coming in with is overwhelming our interventions that we could help them with. And so we have to find better ways to follow them home.
Absolutely. And talking about scale, I really feel like, there's a limited number of doctors that can pick apart the complexity, right, of tough cases. Scaling that number is going to be difficult because they have to come through the kind of training you're providing. But I think we can scale this part of what you're talking about. We're talking about we can scale the autoimmune coaches, what Tom O'Brien was talking here at the moment. There are people out there that are hungry. They've been through these kind of issues. They've had gut issues. They've healed them. They're coming out the other side saying, I don't want to be a lawyer anymore. Like, what can I do? I think there's a real opportunity for those people to be engaged into the health system in a new way and support these kind of providers. I look at someone like Frank Lippman's practice with, one doctor and 7 health coaches, where he's able to really scale his impact, take less time with patients, but still have a really great sessions with them by the fact that the coach is doing the majority of the work. So we've got a lot of work in front of us, but I really appreciate all 3 of you and Tom O'Brien for coming in and sharing your wisdom. We really have an amazing group of physicians leading this charge toward more evolved medicine, and it's been very great to have you here all on the Functional Forum, making your debut as well.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you. It's called the 5 Steps to Becoming a Leader in Your Wellness Community, and it'll give you some of the starting points on how to position yourself as the leader in your zip code of your health community. All you have to do is click on the link below.